Hi, my name is Connor Dunn. I am a student physical therapist here at RMU, and I'm here with my patient Bonnie. She is a 26-year-old female who is having some low back pain, and it's been about 2 years dealing with this. She encountered that during her last pregnancy, which was 2 years ago, and she's the mother of 2 small children, but she does not report any pregnancy at the moment. So in the stage of tissue healing, she would be in that maturation stage. So those proteins and collagen fibers are being laid down there and organized, but still having some pain. So I'm thinking about trying some ultrasound with her to help relieve with that and help with that tissue healing process. So I would want to go for a thermal effect. So if we come over here, I'd want to have it on a continuous cycle to elicit that thermal response. And since it's that lower back pain, I'm thinking not going completely down to that 1 megahertz where deep penetration to that tissue. I want to aim for that 2 to 3 range because I want to get some deep tissue response, but I do not want to go too deep for that. So 2 to 3 is where I'm thinking, and I would want to go for 8 to 10 minutes to help elicit that thermal response. In that power and intensity, I want to be around 1.5 because that is what is recommended to help with the minimal detectable change in that tissue. So some indications are pain, and especially inflammatory or chronic pain. And for my patient specifically, I want to try to help with that cell permeability, help promote that healing process. Some contraindications would be any sensation issues, any circulatory issues, active cancers, active pregnancy, any deep vein thromboses, and also some cognition or mentation issues. How's it going today, Bonnie?
It's all right. How are you?
Doing all right. I know I've understood that you've been having some back pain for quite a while now.
Yeah, it's been a long time.
So Dr. Miskin wanted me to try to, I was thinking about some ultrasound, see if that could help with some pain. Have you ever had your ultrasound before?
I've had ultrasound to like see the gender of my baby, but not like on my back.
So this is a different type of ultrasound. It's
Okay.
a therapeutic ultrasound, so a little bit different from
Okay.
what they've had to look at your babies.
Okay.
But essentially the way it works is this little head here, I can adjust the settings, but it emits some sound waves, so it kind of vibrates that tissue underneath and can help heat that up. So it could help with some of that pain that you're dealing with, help
Okay.
with that healing process.
Okay.
That makes sense?
Yeah, that sounds great. Like, I like heat and I like healing.
Awesome. So, be interested to try it today?
Yeah.
Awesome.
Yeah, let's go for it.
So, I'll have you lay down on your stomach and I'm gonna see how your sensation is.
Okay.
But before we do that, do you have any active cancers?
No.
Okay. Do you know if you're currently pregnant?
No.
Do you have any others aware of that your sensation issues?
No. I feel like everything is working fine.
Okay. Any blood flow issues, arterial diseases?
No. No. I'm pretty healthy.
Okay, that sounds good.
Yeah.
All right, so if you wouldn't mind, and I'm gonna pull up your shirt and tuck this towel underneath so I don't get any of that ultrasound gel.
Okay. Yeah, I appreciate that.
Okay. So if you wouldn't mind laying on your stomach, I'm just gonna use this gel to make sure it moves around smoothly. All right, so if you wouldn't mind pulling your shirt up a little bit, I'm just gonna tuck this underneath. All right, so I'm gonna find where that point is. And you said it was on the right side, correct?
Yeah, the right side.
All right, so kind of right in there, pretty tender.
Mm-hmm.
All right. So we're just gonna start right here. I'm gonna apply some of this gel. Might be a little cold, so brace yourself. All right. So I'm going to set this up so it's that continuous cycle. Go 2 megahertz, then 1.5 for that intensity. And I want to touch this gel to the head before I turn it on so I don't damage that crystal. So you should feel some heat. Let me know if there are any hot spots or if it's burning at all. I'll try to adjust from there.
It is warm.
Feeling that heat already?
Mm-hmm.
So far, so good?
Mm-hmm.
Good. So I'm going to use small circles because that ERA, that effective radiating area, is only about 2 to 3 times as wide as the crystal, which is slightly smaller than the head of the ultrasound probe. But once 8 minutes is done, the machine will go off. I want to make sure the machine is off before taking the ultrasound probe off of the gel. I'm going to wipe that off. Then wipe off the gel from my patient here. How's that feeling, Bonnie?
That feels great. It feels much better.
Great. All right.